Hello, everyone. Today, we have a special walking routine for seniors who have had a hard time walking because of knee pain. Did you know that half of adults in their 50s and older suffer from knee pain? After their 60s, arthritis can be the second most common disease after cancer. But don't worry, if you continue to follow the routine we're teaching you today, you can reduce knee pain and get back to a lively routine. Knee pain can cause discomfort when walking or moving, and in severe cases, it causes pain day and night, which greatly reduces the quality of life. Aging can reduce the amount of lubrication inside the knee, making joint movement stiff, and walking in the wrong position, or lack of stretching before and after exercise can put additional stress on the knee. If you don't move because your knee hurts, your blood flow can drop, your muscles can weaken, causing more pain and a vicious cycle of restricting your movement. But walking is the most basic exercise of our body, and is very important for joint health. Don't forget that you need to move your joints to stay healthy. Walking exercises can keep your joints healthy, make your daily life comfortable, and even make you feel good. So, the senior walking routine to reduce knee pain. Let's start together now. Step 1: Warm up 5 minutes. Before walking, make sure to stretch your pelvis and ankles enough to soften your joints. In particular, calf stretching is a must. Slowly, follow the next 5 minutes of stretching. Ankle turn both ankles clockwise and counterclockwise 10 times each. Spinning the knee, put both hands on your knees, and lightly rotate your knees in a circle, 10 times each clockwise and counterclockwise. Calf stretch: hold the wall and stretch one of your legs back to stretch your calves. Repeat 3 times for 15 seconds. Do the same for the other leg. Thigh stretch: bend one leg back to grab your ankles with your hands and stretch the front of your thighs. Repeat 3 times for 15 seconds. Do the same for the other leg. Pelvic stretch: stand with both feet shoulder width apart, and move your pelvis from side to side with both hands on your waist. Repeat 10 times. Step 2: Proper walking posture 15 minutes. Walking in the right posture is very important to minimize the burden on your knees and maximize the exercise effect. Make sure to walk while remembering the following points. Gaze: walk facing the front. Be careful not to look at the floor or bow your head. Back: straighten your back and open your chest wide. Take care not to walk slouch. Arms: your arms naturally shake back and forth. It is more effective by bending your elbows 90 degrees. Foot: walk with the feeling of pushing with your toes as you touch the ground from your heels and move your weight throughout your feet. It is recommended to walk in an 11 shape, parallel, being careful not to point your toes outward or inward. Stretch: keep your comfortable stride, not too wide or narrow. It is also a good idea to practice your posture while looking in the mirror at first. It aims to keep a proper posture and walk slowly. Beginners start with 60 to 80 steps per minute and gradually increase. Getting into the rhythm while listening to music can be helpful, too. Step 3: Knee strengthening exercise 10 minutes. If your knee joints are weak or pain is severe due to arthritis, you need strength training to reduce the burden on your knees. Exercises that strengthen the muscles of your hips, thighs, and calves are especially effective in relieving knee pain. Try following the following exercises consistently for 10 minutes. Lying and lifting legs: lie down with your back on the floor and lift one leg about 30 degrees. Repeat the exercises for 15 times to apply and relax. Do the same for the other leg. Sit and straighten your knees. Sit on a chair and stretch your legs forward and fine open your knees. Hold for 15 seconds while feeling the strength in your thigh muscles. Repeat 10 times. Stand and lift your ankles: stand and hold a wall or chair, and lift your heels to strengthen your calf muscles. Repeat 15 times. Calf lift with chair variations: stand behind the chair and hold the chair, lift the calf with only the forefoot touching the ground. Repeat 15 times. Stand and lift your back thighs using a chair: stand behind the chair and hold the chair, lift one leg back to strengthen the muscles behind your hips and thighs. Repeat 15 times. Do the same for the other leg. Step 4: Finishing stretch 5 minutes. After working out, it is important to finish by stretching to relax your tight muscles and improve your flexibility. Repeat the stretching you did during warm-up exercises, or do the next stretching additionally. Butterfly stretch. Sit on the floor and repeat the action of bending and stretching your knees with both soles of your feet facing each other. Sit with your legs spread. Stretch. Sit on the floor. Spread your legs as wide as possible, and lower your upper body forward. Each stretch is repeated 3 times for 15 seconds. Additional tips for relieving knee pain. Tip 1. Natural ointment using ginger, honey, and garlic. Ginger rolls in ginger suppress inflammation, enzymes in honey regenerate cartilage, and allicin in garlic improves blood circulation. Applying an ointment made by mixing these ingredients to your knees can help relieve pain. Tip 2. Poultice. Poultice packs can be used to relieve joint pain. Warm poultice promotes blood circulation and relaxes muscles to reduce pain. Tip 3. Regular exercise. Working out consistently about 3 times a week will improve your body during the recovery process of muscle fatigue. Tip 4. Stretching. 3 minutes of daily stretching can relieve knee pain. Precautions. If you have severe knee pain or swelling, you must visit an orthopedic clinic and see a doctor. How was your senior walking routine to reduce knee pain that I taught you today? If you keep practicing it, you'll definitely be able to relieve knee pain and enjoy a more vibrant life. Start today. If it helped, please like and subscribe. I'll come back with useful health information next time. Thank you.